And when it comes to drugs and alcohol, just say no.
Just say no.
With drug policy, we need to realise insanity is doing the same thing over and over again and expecting a different result.
America's public enemy number one is drug abuse. It is necessary to wage a new all-out offensive. This will be a worldwide offensive.
The reason that I don't support the criminalisation of drug users anymore is because my own experience is that it had very little positive impact on whether I used or didn't use. The harms I did to myself, they were increased after the police involvement.
Those people using heroin shouldn't be asked about what drug they're using. They should be asked what pain they're in. That drug use is self-medicating pain, significant pain. Why would anyone put themselves through that voluntarily?
When people use drugs, two things can happen. They can become addicted to drugs, in which case they've developed a mental illness, and it's therefore completely appropriate and sensible to treat the illness. But the majority of people who use drugs don't become dependent and therefore are not mentally ill. These people's lives will be much more damaged by a criminal sanction, a criminal record, than by allowing them to continue to use drugs.
Up until the end of the 1960s, if you had a problem with heroin, you went to the doctor, you got it prescribed. It was called the British system. At the time when the British system ended, there were 1,049 heroin consumers in the UK. 20 years later, that went up to 300,000. Before organised crime had control of the market, there was no incentive for anyone to find new customers.
It's time for us to really examine what we're doing and to use evidence.
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 At the moment, a lot of our policies are based on ideology, not evidence.